Good day and welcome. In today's segment, we're delving into one of the most emotionally charged and heavily debated shifts in UK immigration policy in recent times, a transformation that directly affects the health and care worker visa. For years, this visa was seen as a beacon of opportunity, a dedicated, expedited path for healthcare professionals from across the globe to serve a strained NHS while building a life in the UK. It was more than a work permit. It was a statement, a message. That said, we need your skills. We value your care. You're welcome here, but as we step into 2025, that message has been dramatically altered. The warm invitation once extended to healthcare professionals has been quietly withdrawn for many. The gateway that was once open and accommodating is now restricted and, in some cases, completely closed. If this is your first time joining us, don't forget to subscribe and turn on notifications for the latest, accurate updates affecting your stay in the UK. Let's get into the details. Whether you're a nurse, doctor, care assistant, or simply considering this route, it's imperative you stay informed. The regulatory framework has undergone substantial changes, and understanding these developments isn't optional, it's essential. Our focus today is to demystify these reforms. We'll look past political talking points and distill what's actually changed, who is impacted, and how the health and care worker visa now functions, setting the context originally introduced to accelerate the recruitment of essential medical and care professionals. The health and care worker visa brought with it a suite of important benefits, reduced application costs, an exemption from the NHS surcharge, and a straightforward 5-year track toward indefinite leave to remain, permanent residency. Importantly, it also allowed applicants to bring their immediate family, spouses, and children with them. The offer was simple: come care for our society, and you may bring your loved ones to build a life with you here. The major shift this is where the most consequential update lies. As of the latest rules introduced in 2025, overseas professionals arriving in the UK to take up roles as care workers or senior care workers are no longer permitted to bring dependents under this visa category. Let's be absolutely clear. If your job offer is specifically for a care assistant or senior care role, your spouse and children are not eligible to accompany you under the same immigration route. You would have to come alone. This revision has sent ripples of distress across communities globally. For many hopeful applicants, the promise of opportunity now comes with a painful ultimatum. The reasoning behind the reformed UK government has defended the change, citing what it describes as an unsustainable surge in dependents entering the country through this visa pathway. Data presented by the Home Office showed that, on average, for every care worker arriving, at least one dependent followed. According to policymakers, this placed unanticipated strain on public services, a situation they argue diverged from the visa's intended purpose. Yet for prospective migrants, these justifications offer little comfort. The practical outcome remains harsh, an intensely personal and difficult choice. Do you leave behind your family, your partner, your children, in pursuit of a career that could support them in the long term? Or do you forego the opportunity altogether to avoid years of separation? Imagine caring for strangers' loved ones day in and day out, while only able to see your own children through a screen. That's the stark new reality confronting many aspiring care workers. The emotional burden of this shift is enormous, and it's a challenge that every potential applicant in this sector must now reckon with directly. But before we go further, let's clarify who is not affected by the recent changes to dependent eligibility. If you're a registered nurse, doctor, paramedic, physiotherapist, occupational therapist, or any other medical professional whose occupation is part of the broader health and care worker visa, but not classified as a care assistant or senior care worker, your ability to bring family members with you remains unchanged. For these healthcare professionals, the structure of the visa continues to offer the same key benefits. However, this policy change has essentially created a split system. One track remains open and supportive for registered medical professionals, while the other, the care worker route, has become considerably more limited and isolating. The second major reform doesn't focus on workers themselves, but on the organizations employing them. Designed to combat abuse and unethical recruitment practices, the UK government now mandates that any care provider in England wishing to sponsor migrant workers must be officially registered with the Care Quality Commission, known as the CQC. The CQC is the independent body that monitors and regulates health and social care services in England. This measure was introduced after numerous cases emerged of newly licensed sponsors turning out to be unqualified intermediaries or shell entities that never intended to provide actual care or jobs. In many of these heartbreaking scenarios, workers arrived in the UK to find no employment waiting for them. Stranded, jobless, and deep in debt, they became vulnerable to exploitation. Under the revised rules, sponsorship can now only be issued by verified care providers regulated by the CQC, and for applicants, this introduces a crucial step in the vetting process. You must independently confirm your employer's CQC registration status before accepting an offer or making any payments. This check can be easily performed on the CQC's official website if the organization does not appear in the registry. It is not legally allowed to sponsor foreign workers. Knowing this can protect you from fraud and help you avoid devastating consequences amidst all these policy shifts. It's important to recognize what hasn't changed because there are still clear advantages to the health and care worker visa. Most significantly, this visa remains exempt from the recent surge in salary thresholds introduced under the General Skilled Worker route. While most other skilled workers must now earn at least £38,700 per year to qualify, applicants under the health and care visa can still rely on NHS national pay scales, a far more attainable benchmark for many roles. This exemption is a major advantage. In addition, those on the health and care worker route are not required to pay the immigration health surcharge, a fee that now exceeds £1,000 per person per year. Over the span of a 5-year visa, this adds up to substantial savings. The visa application fee itself remains lower compared to other categories. And most importantly, the 5-year pathway to settlement in the UK, known as indefinite leave to remain, is still available. The opportunity to make the UK your permanent home is still on the table. A deeply personal decision. So, where does this leave us? Is the health and care worker visa still worth pursuing in 2025? The answer now depends entirely on your situation. If you're a qualified healthcare professional, a nurse, a doctor, or similar, the route remains highly favorable. You still enjoy the key benefits, and your family is still eligible to join you. This remains the most attractive immigration offer the UK extends to global medical talent. But if you are entering the UK as a care worker or senior care worker, the reality has changed dramatically. The financial incentives may still be there, but they now come with a heavy emotional price. The certainty of being separated from your family. It's a difficult trade-off. A decision that now demands a great deal of reflection, planning, and mental resilience. The government's strategy has become unmistakable. While still eager to attract high-skilled medical staff, there is a concerted effort to restrict lower-paid care workers from relocating with their families. Some would call it pragmatic. Others would argue it's cold and uncompromising. Whatever your perspective, the new rules demand careful preparation. That means getting your documentation in perfect order and preparing emotionally for the reality this visa now entails. Verify your sponsor's CQC registration. Understand the consequences of the dependent restriction, and make your decision fully informed and with clarity. The UK's healthcare system still needs you, but the terms of your welcome have become more complex, more conditional, and, for many, significantly harder to accept. Thank you for watching.